everyone, this is Suprabha. Welcome back to another session with me. In today's session, we will be discussing about head injury in children. Well, head injury is one of the most common causes of death and it is more common in young adults. So if we see the incidence, then every year almost around 5 lakhs children suffer from head injury. So when there is head injury, there's also one more term comes with it, which is traumatic brain injury, right? So if there is head injury, there's a possibility that the brain will also get affected, or there will be injury to the brain also. So it depends on the severity of the injury. Well, so let us move on to the meaning of head injury. A head injury is any trauma to the scalp, skull or brain. So if any of these parts get affected, and if there is injury to any of these parts, we call it as head injury. Now, this injury might be very minor. It might be in the scalp only, or it might, go to the skull. And also, sometimes, if it is very severe, in that case, it might injure the brain also. So, as I mentioned earlier, that it depends on the severity of the injury, right? So, whether there will be traumatic brain injury associated or not. So next, let us move on to the causes of head injury in children. Now here, while discussing about causes of head injury in children, we will go according to their age. So first, we will discuss that in infants, what are the causes. Now in infants, what can be the cause? There might be falls or abuse. So as in this age they start to crawl, they start to roll on the bed itself. So what happens, there is a possibility that some objects, as they might push the objects, or it might fall on them, right? So there is a possibility that certain objects, if there is heavy objects near the infants, that might fall on them and there might be head injury, right? Next thing is abuse, right? So if there is abusive parents, or if there is any abusive family members, or caretaker, in that case also there might be head injury. Next, we would see what are the causes of head injury in toddlers, right? So here in toddlers also, it is abuse and falls. Now, that in this age, when they're toddler, they take their first step, right? So again, there is a possibility that, certain, if there is heavy objects, heavy furnitures, that might fall on them and there might be head injury. And again, if there is abuse. And then there are school-aged children. So in school-aged children, again, the injuries can be related to play and sports. So there might be sports-related injuries, and due to that, there might be trauma to the head. And also there might be motor vehicle accidents. So if there is road traffic accidents, due to that also, there might be head injury in toddlers. Next is adolescents. So in adolescents also, it is very common that there might be, road traffic accidents, or we can say motor vehicle accident. And then if there is assault. So what we can see is assault or abuse is the cause across all age groups, right? So among all age groups, we can see that this is a very common cause of head injury in children. Well, next we would talk about the brain injury mechanisms. Now, there are several brain injury mechanisms through which a brain can get injured, or there might be trauma to the head. So the first thing is blunt trauma. Now, from the name blunt trauma, what we mean to say is that when the head gets injured by a blunt object, we call it as blunt trauma. So there is no sharp ending. Well, you might be aware that, we do neurological examination, and for that we use Glasgow Coma Scale, right? So this GCS score tells us the condition of the patient. And here, based on the GCS score, we would be able to, tell how severe the head injury is. So if the GCS score is 13 to 15, then we can call it as mild head injury. So in case of mild head injury, the GCS score would vary from 13 to 15. And then if the GCS score is 9 to 12, then we call it as moderate head injury. And if the GCS score is less than 9, if it is less than 8 or equal to 8, then we call it as severe head injury. Well, so these are the grades of traumatic brain injury. Now, there are different types of brain injury. So, let us understand what are the different types of brain injury that might occur. So, the first thing is fracture of skull. So, fracture of skull is more common in neonates because of their bone elasticity, and also we can see the type of this fracture is, mostly it is depressed type. And then there is intracranial hemorrhage. So, intracranial hemorrhage is also common in neonates due to excessive molding of skull bones, or during forceps delivery, it is very common. So, in case if there is rupture of this delicate surface veins, then there might be intracranial hemorrhage, and sometimes it can lead to neonatal death also. And next there is concussion of brain, or we can also call it as cerebral concussion. So we've already discussed what we mean by concussion. Now if there is concussion or if there is cerebral concussion, what might happen? There will be loss of consciousness and also loss of memory. And next there is epidural hematoma. So epidural hematoma happens following head injury, mostly in the temporal or frontal lobe or in posterior fossa. And next we have acute subdural hematoma. So this basically results from a severe head injury, but also if there is minor head injury and the patient has any bleeding disorder, in that case also subdural hematoma might occur. And then there will be brain swelling. So this may found in association with head injury, or if there is any vascular congestion. So if there is contusion or intracerebral hematoma, in that case focal brain swelling may occur, and if there is hypoxia, due to that there might be cerebral edema. Well, that was all about the types of head injury. Now, the rest of the topic would be discussed in a different session. And let us conclude our today's discussion. So, in today's discussion, we learned about head injury, meaning of head injury, and what are the causes of head injury in children. We also learned what are the different brain injury mechanisms are there. And then there are grades of traumatic brain injury, and also what are the types of head injury. So to learn about clinical manifestations, complications and management of head injury, please refer to the second part of this video. So I hope you have got a better insight about the topic. Thank you. Next is penetrating. So what is penetrating? Now here, if there is any sharp object and that hits the head, what will happen? That will pierce the skin, right? So it will pierce the skin and enters the, it will enter the brain, right? So it will pierce the scalp, and then through that it will hit the skull, and also it might enter the brain, right? So it will create an open wound. So that is what is called as penetrating trauma. And then there is diffuse axonal injury. So what is diffuse axonal injury? Here what happens, there will be tearing of the axon. And then there is concussion. So in concussion what happens, it is a type of traumatic brain injury. And what basically happens here, when there is a direct blow to the head or to the other part of the body, which causes the brain to move back and forth very rapidly, and if that happens for multiple times, then there what happens is called as concussion. Well, I already mentioned that whether this injury would be only into the scalp, or it would invade the skull, or it would injure the brain also, that depends on the severity of injury, right? So how we would get to know that how severe it is. So for that, let us move on to the grades of traumatic brain injury.